And hit it.
Okay. Hello, my name is Scarpella. Welcome to my 2025 Senior TED Talk about exploring the impacts of psychedelic therapy on mental health disorders. We spend so much time treating the symptoms of mental illness, talking through it, medicating it, surviving it. But what if healing means going deeper? What if the answer isn't numbing the pain, but transforming it? That is what psychedelics help people do, and that has changed what I believed about the mind. So, to what degree can psychedelics help people with PTSD, anxiety, and depression overcome their trauma? First, let's learn about what the most commonly used psychedelics are for psychedelic treatment. There are many psychedelics that can be used to help treat mental disorders, but the most common are these three: psilocybin, MDMA, and ketamine. Psilocybin is a naturally occurring psychedelic found in numerous amounts of mushroom species. It's a serotonin receptor agonist that, when ingested, converts to psilocin, and the active psychoactive substance, causing altered perception, euphoria, hallucinations, and a distorted sense of time. MDMA is an empathogen drug with stimulant and minor psychedelic effects. MDMA uniquely induces prosocial and subjective effects of heightened trust and self-compassion, while maintaining ego functioning as well as cognitive and perceptual lucidity. Ketamine is a dissociative anesthetic hallucinogen that has some hallucinogenic effects. Ketamine distorts the perception of sight and sound and makes the user feel disconnected and not in control. It is referred to as a dissociative anesthetic hallucinogen because it makes patients feel detached from their pain and environment. Ketamine can induce a state of sedation, feeling calm and relaxed, immobility, and relief from pain. Of course, all of these psychedelics should be done in a therapeutic setting and not recreational. PTSD, anxiety, and depression are significant public health issues in the U.S., affecting many individuals and highlighting the need for strong mental health treatments. These are some of the mental health conditions that warrant the need for psychedelic therapy. Post-traumatic stress disorder, also known as PTSD, is a psychiatric condition that may occur in people who have experienced or witnessed a traumatic event or a series of traumatic events. The individual often experiences the event or events as emotionally or physically harmful or life-threatening. Anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical changes such as increased blood pressure. Depression is a common and serious mental disorder that negatively affects how you feel, think, act, and perceive the world. Mental health problems are currently among the leading causes of disability worldwide, with substantial personal, social, and economic costs attached. As a result, improving mental well-being should be a top priority for personal health as well as in healthcare systems. This is a graph showing the number of U.S. adults receiving mental health treatment or counseling that has been increasing each year. As you can see here, from 2002 to 2023, the number of adults that have receiving mental health treatment or counseling has gone up from 27.2 million to 59.2 million, showing a 117% increase in adults receiving health treatment or counseling, showing how big of a problem mental health really has become. Psychedelic therapy offers an alternative option of PTSD treatment. PTSD is proven to be difficult to deal with, a mental disorder affecting about 7.7 million adults each year, and about 1 in 11 individuals at some point in their lives. Since PTSD is affecting about 7.5 million adults each year and 1 in 11 people, many existing treatments do not work for everyone. So this makes it important to explore new options like psychedelic therapy to better help those struggling with this condition. The psychedelic approach to therapy is very different from more traditional therapy. Some more traditional therapy suppresses depressive symptoms, which can take months or years to treat. Some mental health treatment with prescription medication can potentially cause adverse effects such as weight gain, loss of libido, and emotional numbing. In comparison, psychedelic therapy focuses on the causes of the problems versus suppressing them. Michael Pollan is the author of How to Change Your Mind, What the New Science of Psychedelics Teaches Us About Consciousness, Dying, Addiction, Depression, and Transcendence. He's a leading expert and researcher in the field of psychedelic therapy research. Here's a short clip of Michael Pollan speaking about the healing powers of psychedelics.
Really exciting field of research underway right now, looking at psychedelics, especially psilocybin, the ingredient in magic mushrooms, to help people deal with mental illness of various kinds. Addiction, depression, obsession, and the fear and anxiety that surrounds the terminal diagnosis. And the feeling among the scientists is that these chemicals allow us to essentially reboot the brain. All those kind of deep grooves that lock us into patterns of both thought and behavior are dissolved and temporarily suspended in a way that allows us to break those patterns.
According to Heather Stringer, an estimated 40 to 60% of people with PTSD do not respond to selective serotonin reuptake inhibitors, which is the first-line medication for that condition. And many do not respond to trauma-focused psychotherapies either. So even though psychedelic therapy may not be the answer for everyone suffering from PTSD, anxiety, or depression, it can be the answer for those who have tried everything else and still not been successful in showing things like enhanced brain adaptability, an enhanced mind and body connection, and emotional insights. And those are just 3 benefits that people see when they do psychedelic therapy. A big question I'm sure many people ask when they hear about this idea of psychedelic therapy is it legal? The use of psychedelic substances such as psilocybin, ketamine, and MDMA for mental health treatment in the United States varies due to legalities from state to state. It is important to raise awareness. There is a rising number of options for people depending on which city and state that you live in. Psilocybin is currently legal for therapeutic use in Colorado, Michigan, and Oregon, and it is either decriminalized or fully illegal in every other state. Ketamine is legal for medical use and therapeutic use in all 50 states and the District of Columbia. It is the only psychedelic substance that is legal in all 50 states for medical use and therapeutic use. And MDMA is only legal in the United States in the context of clinical trials that are approved by the FDA, or in context of case-by-case circumstances in which its use was considered medically essential. The legal status of these psychedelics is hard to track due to it changing each year. According to my research, psychedelic therapy can offer patients a perspective shift in their lives. It can give a new sense of connection in patients seeking therapy for PTSD and other trauma-related mental illnesses such as anxiety or depression. Results from psychedelic therapy helping form new connections can include rebuilding trust, safety, and acceptance, and a mindful connection to oneself and others. In a clinical trial completed by a Multidisciplinary Association of Psychedelic Studies, or MAPS, a study for PTSD to develop a better understanding of MDMA-assisted therapy for 7 participants, 3 women and 4 men. Maka Good says in the study, the patients reported significantly improved conflict tolerance, connectedness, and positive emotions. In addition, they showed increased acceptance, self-forgiveness, and self-empathy, which are vital in addressing the moral injury and the feelings of guilt and shame common to severe PTSD. One PTSD patient in another MDMA trial shared, "I feel love and compassion, and it's not just for family, it's for everyone. My parents and I have a much better relationship now. No doubt the study helped me get me there." Now I want to show a brief excerpt from a TED Talk with Dr. Roland Griffiths. He was a a professor at the Department of Psychiatry and Neurosciences at the Johns Hopkins University School of Medicine and founding director of the Johns Hopkins Center of Psychedelic and Consciousness Research. In this excerpt, he discusses the benefits of psychedelic therapy and cancer patients.
So we've continued this whole line of research over the last several years and studied other populations, the first of which are psychologically distressed cancer patients. So we've recently completed a study in 51 cancer patients with life-threatening cancer diagnosis who met clinical criteria for having a depression or anxiety disorder. These volunteers were randomly assigned to receive either a low dose or a high dose of psilocybin under double-blind conditions.
This graphic that Dr. Griffith presents in the video, it comes up right after the video ended, so you can actually see it. But he presents this graphic, and this shows the percentage of volunteers showing clinically significant improvements in depressed mood. The orange bar shows that 92% of those who received a high dose of psilocybin 5 weeks after the session were showing clinically significant improvements. The green bar shows that 32% of participants with a low dose 5 weeks after the sessions showed significant improvements. And the blue bar shows the effects are sustained out to 6 months, which means that 80% are continuing to show clinically significant improvement. According to Dr. Griffiths, this single exposure to a substance producing substantial antidepressant effects is remarkable. I want to share a story of a cancer patient's experience who participated in a psilocybin-assisted psychotherapy for cancer-related emotional distress and anxiety. Adam is a 23-year-old male diagnosed with lymphoma. He described an overwhelming anxiety that was greatly impeding his life. He couldn't sleep, his anxiety was through the roof. He says, "I thought my cancer was back. I had a really rapid heartbeat. It is like your mind is clogged. You know you can't think of anything else but this. And it is kind of like despair. You know there's nothing you can do. It is completely out of your control." Eventually, Adam developed an addiction to alcohol and anti-anxiety medications, which frequently led to whole days in which he was not in his own mind, or not in the right mind. After his psilocybin sessions, Adam, who initially described his crazy anxiety and debilitating fear of cancer reoccurrence, similarly came to not only accept the fact that he could have cancer reoccurrence, but also a greater embracing of his remission. Adam indicated that the psilocybin experience helped him realize the importance of caring for his emotional needs and pursuing a deeper sense of contentment in his daily life. So how does it work? The first step is usually a preparatory consultation to ensure that you don't have any risk factors to the treatment. This is also a good opportunity to discuss your personal background and any goals or fears you have for the treatment. The second phase involves ingesting either orally or through an IV the psychedelic substance under supervision of a trained therapist and in an appropriate setting. There are usually multiple sessions depending on the type of psychedelic and the treatment plan. For example, MDMA assisted therapy usually involves at least 3 sessions. Ketamine therapy usually involves at least 1 to 12 sessions, and psilocybin therapy assisted therapy usually involves at least 2 sessions. The final phase is the integration process, in which the therapist and the client work together to integrate meaning from the psychedelic experience and talk about what they felt and just talk through what happened. Psychedelic therapy under therapeutic supervision and the integration has proven to help people with PTSD and other mental health conditions overcome their trauma. This treatment can give patients a perspective shift, offering a new sense of connection, a new sense of purpose and gratitude, as well as improving one's overall mental health. Focusing on mental health conditions like PTSD, depression, and anxiety benefits us not only as individuals, but also society as a whole. It's important to not ignore the rising rates of mental health conditions individually and as a collective. Research shows that these treatments can help people reconnect, heal, and move forward in ways other methods have not been able to. Psychedelic treatments offer a rise in awareness on how to improve parts of our lives and therefore our overall mental health. Thank you.